11. Medical Education 1. Medical Education in the UK. Medical education in the UK covers undergrad education for or 5 years or medical school, the section or university responsible for medical education. A 2-year foundation program which provides training for new doctors after graduation through a service of placed in different specialties. See Unit 12. Prograde training which doctors take to become GPs or constant senior specialty offers delivered through colleges or different specialties, for example, the Royal College of Physicians. Continued professional development is the four of the courses and the seminar which doctors undertake through their working lives to keep other day. Exam for undergrad practice. The MBCHB, Bachelor of Medicine Bachelor of Surgery, is a 5 years undergrad medical degree course. Most of your learning takes place in the small group. The main components are core years 1-3. An integrated program of clinical and specific topics only presented through problem-based learning (PBL), where you work with others on series of case problems. Student-select modules SSMS allow you to choose from a menu of subjects such as sport, medicine, or even study languages as preparing for overseas elective or hospital attachment of your own choice between years of and 5. Vocational student and clinical skills. The component prepare you for the clinical skill required for contact with patients for year 1 of your course through period of practitioner trainer where you are attachment to hospital department or general practice. Clinical attachment year 4 and 5. A series of 4-week clinical attachment is medicine surgery, psychological medicine, childhood health, obstetrician, gynecology, and general practice. A student's view. Allen, a medical student, described his course. I am just finishes my first years of medicine. What I like about this course is that you're involved with passion from the very beginning. Even in your first years, we spend time in hospital. Most of the course PVO we have 2 years, 2 hours section a week where we work in group of 8 to 10 solving clinical problems. We decide together who to tackle the problem, look up book and only sources. Make notes and discuss the case together. It is a great way of learning and getting to know the other students. In the past, medical students had lectures with the whole class taking notes from lectures from 9 to 5, but no, it is nails group work. And through we do know some lectures and seminars where we work in small groups with our tutors. I like all if even the decision you get to cough you cadavers from the second month of the course. Mass desk activities to the stages of the medical education in the UK given in A options. 1. Dissection cadavers on the grade. 2. Keeping a love of surgical procedures upstairs and prefer postgrade. 3. Working 4 months is accident and emergency to expected especially foundation program. 4. Talking for week attachment is obstetrician and gynecology undergraded. 5. Taking an early course on recent development cardiovascular disease containing program professional development. Complaint the sentences look at the B and C option to have you. Number 1. Just before their final years, students have the chance to take wages in hospital of the problem basis. Learning contrasts with a freshman where each subject is taught separately. These days on terminal are often interactive with regular opportunities for the student too. ask questions. 4. In clinical assessment, students learn how to trust and manage passions. 5. Student excellence can be a topic from outside medicine, such as for the languages. 6. Disease of the cadavers is an important part of the anatomy component. 7. The medical student, the University of Edinburgh, is one of the oldest in the UK. 8. She is a consul in the Royal on the leading pediatric heart specialty in the country. 9. The royal colors of the surgery in Edinburgh date from 1505. 10. We have similar each week where we discuss topic in a small group with other lecture. Maths or desk activities to one of the component of the undergraduate course described in B and C option. 1. Julie spent 6 weeks working in a small hospital in the Himalaya. Oversized elevator. 2. A group or a student discuss together the possibility reason for abdominal pain after meal in an absent 4 years old male problem-based learning. 3. A small group of students treats the pulmonary artery in cadaver disease. 4. O2 spends a month working in the pediatric ward of the local hospital clinical attachment. 5. A learned how to take blood from an elderly patient clinical skills. 6. Juma chose to study travels medicine in his 14 years student as Lenin.